Hello, I'm Cheryl Barnes-Neff, and I'll be your instructor for this presentation on Chaplain Charting. This presentation is designed for healthcare chaplains who work in the hospital, hospice, long-term care, or assisted living facilities, among others. I've been a registered nurse for over 40 years, and I'm also a hospice chaplain. An important part of my experience was working as a quality manager and working directly in the focused medical review field. I worked at helping patients appeal for coverage when Medicare Review denied payment for their services. This included chart review, written appeal documents, as well as administrative law judge testimony. In this role, I've learned that each and every healthcare professional who contributes to the patient's care is important. It may seem like documentation of care is a burden and has little impact on the patient's care, the legal aspects of care, or the healthcare system as a whole. But I can assure you that the impact is important and real. We'll be covering a lot of territory here, and I do understand how foreign charting can seem. Please feel free to leave questions below, and if you'd like to be informed of new courses or topics, be sure to subscribe and click the notification bell. Before we get started, though, let me include a comment about the fine print. This presentation should be regarded as a supplement to the training you've received from your facility. Be sure to become familiar with the standards of practice published by the Association of Professional Chaplains and follow your job description. Be familiar with your organization's policy and procedure manual and seek guidance from your supervisor. For the course objectives, we'll be taking a look at the end of this presentation that you'll be able to describe the purpose of the medical record, to distinguish between the questions what's the matter with you and what matters to you, to identify the 4 steps in the care planning process, to give examples of at least 3 patient goals, to list possible interventions to achieve patient goals, and to summarize how to evaluate and document patient responses to care. Now, why is charting important? Communication with the team is the most important part of why we do documentation for the care. If you've ever been a patient yourself, you may have discovered that every single person who walks into your room asks the very same questions. And yet, if you ask those healthcare professionals, they probably would say, oh, I just don't have time to read the chart. But I can promise you that when we do take that time to read the documentation and to review what's been going on with the patient, that care for the patient is more seamless from their perspective and their point of view. And it's very valuable to learn things that perhaps I've observed that you won't have a chance to observe because the patient's condition has changed over the intervening hours between our visits. The other part of this is that the chart is a legal document. If you would ever have to testify about a patient's care, your testimony and the charting must match. So you're not expected to memorize everything that happened with your patient so that just in case in the future you'd be able to do that testimony. Or don't assume that because you're a chaplain you won't be asked to participate in a deposition. We're all part of the patient record. We all play a part in the care the patient has received. And if there are problems with that care, they want to see the perspective of each and every person who had interactions with or had interventions that they helped with the patient. So definitely be aware of that and write the detailed information about what you've done with your patient so that you would be able to remember that patient as a whole based on what you've written. One of the things I like to tell people when I teach charting for whether it's nurses or social workers, chaplains, respiratory therapists, whoever, that if I gave you 3 different charts and blacked out the names, and there were 3 patients in a row, would you be able, by reading the chart, would you be able to put the correct chart on that patient's bed? So by being able to paint the picture of what's going on with the patient, then you're going to be able to approach that care for that patient in a far more professional manner and be more successful in working with that patient. The patient will appreciate it as well. It's also a detailed invoice for billing purposes. Now, sometimes when surveyors come into our facilities, it's really common to be a little, maybe a little skeptical about, well, why are they here? They just want to find things that are wrong and, to justify their existence. But from a surveyor's point of view, they want to be sure that their beneficiary, they don't call them our patients, they call them their beneficiary. They want to be sure that their beneficiary is getting what they're paying for. They don't want to find that we're just simply, warehousing a patient in a bed and not providing them with the care and services that they need. So that detailed invoice is available for them to be able to look at. In the focused medical review field, that's something that becomes very important if coverage is denied. And we want to be able to go in and appeal that decision so that that deserved services are covered and paid for the patients, so that they don't have an additional financial burden. So it's a very important part. Now, charting basics. One of the most important things to stay within our scope of practice. Sometimes we may be able to do additional tasks or additional services, but yet we really weren't hired for that. If you also have a credential in other types of counseling or other aspects of care, but you're hired as a chaplain, then you're really not part of that other department. So you shouldn't be doing those services. It doesn't mean that you're not capable or competent. It means that you stay within your job description. Perhaps if you do have other credentials, you can talk with your supervisor about expanding your role and expanding the scope of your job description. But be sure in the meantime that you're sticking with that job description. The other thing is to observe and report your observations. So as you're observing things about the patient, it's very important that you report on those things. Let's say that you have a habit, it's a good one too, to go in and shake hands with your patient. Now, if you're in a long-term care facility or even hospice, you might go in, introduce yourself, shake hands with the patient, and maybe you don't see the patient for a week or more. You go back in and shake the patient's hand, but notice that their grip is a little weaker. Maybe by the time a month goes by or more, the patient can barely lift their hand. Maybe you just slip your hand under theirs and give them the reassurance that you're there. Do you see what I'm saying with taking a look at the decline that's happening with the patient? It's very important to report that to the primary nurse or your team to be sure that they're aware of that. One of the things that we tend to do is we forget to look at our patients with fresh eyes every single time we visit them. It's so easy if you've probably driven down the street and go on your same route to work every day. And then somebody will ask you at work, well, how are they doing coming with building that new 7-Eleven that's down the street from you? And you may say, oh, wait, I don't know. And then as you drive home, you notice, oh gosh, they're building a new building. Maybe fencing has gone up, whatever the case might be. But you haven't really noticed because it just seems like the same route every single day. So you don't notice those changes. The same can actually happen with patient care. So all of us working together are really important to be sure that we're recognizing and evaluating how things are going with the patient and reporting to the physician, to the nurse for medical aspects, and also with collaborating with your social worker for emotional impact, the emotional impact of the patient's disease process and how they're feeling about things. So taking a look at that aspect of reporting, we also want to make sure we're charting just the facts. We want to be objective as much as possible and then use everyday language. We need to be understandable as we chart. There's no advantage to being super and hyper clinical and academic in the way we chart about our patients. We're not writing a term paper. We're trying to communicate with our patients and with our healthcare team. So being sure that you are writing about the patient in terms that you would use if you're simply giving a report or you're talking with the patient about, I'm talking about to the rest of the staff about how the patient's doing and what's going on with them. So if you're questioning, well, what do I write? I don't know how to write that. Simply ask yourself, well, if I picked up the phone and called my nurse, the primary nurse or my social worker or another chaplain teammate, how would I describe what's going on with the patient? And that's what you should write. So in charting for chaplains, the really important part, the different component parts, are looking at the spiritual assessment. And it's something that you should do at every single visit. Perhaps the first visit will be more comprehensive and take a little longer, but each and every visit you want to be looking at an assessment of how the patient is doing on a spiritual level. Are they keeping in connection with their friends and family, with their other members of the congregation, with their own pastor? Are they feeling disconnected and separate from God, from their spiritual rituals, from their practices? Perhaps there are other issues that come up during their stay with you at their facility. So very important to assess that every single time you visit the patient. The other thing will be identification of patient's symptoms related to their spiritual state of mind. Now we'll go into that in more detail, but certainly there are times that a patient is having difficulties with their coping mechanisms. Perhaps they are experiencing grief. Perhaps they have despair or distress based on their concern that perhaps they're have difficulties with, will I be going to heaven when I die? Will I be able to be in connection and communication with God because of the different things that are happening with me right now? Perhaps their family members are struggling and having a difficult time with the patient, perhaps based on some aspects of their life that doesn't seem to mesh or gel with the spiritual practices that they've been raised with. And it's difficult to then work with that patient, make sure that we can do our best to bring reconciliation among the members of the family, as well as members of their congregation, and especially with God. So care planning then becomes very important to develop interventions to help achieve that patient's goals, to take a look at how they look at goals for their spiritual life. And we'll talk about that again in the next section so that we can clarify some of those things that can seem a little lofty to talk about goals, but really we're just simply talking about that I want to feel better in most cases, so that if I'm feeling lonely and feeling disconnected from my family, from my congregation, from God, then when I take a look at saying, well, what is the goal? To feel more connected. So it can be very simple. And again, we'll be discussing more of those details as we go along. The fourth and very important part then is to document that for each of your visits. You don't want to write the great American novel. We also don't want to have that be so sketchy or so thin that it's visited patient, offered prayer, patient thanked me for my visit and I left. We want to make sure that we have enough description in the chart to understand what's going on with them and understand why we visited in the first place, and then what good did we do. And we'll talk about exactly how to do that in the coming sessions here. So I think you'll find that it's actually a lot simpler than it might seem just looking at a few bullet points. So now let's take a look at the next question. What's the matter with you is a question that often is asked for patients, and yet we also want to compare and contrast that to the idea of what matters to you. And I think that you'll appreciate that this is especially important for chaplains and something that chaplains are already very good at. And it's something that adds a tremendous amount of value to the patient's care and to the charting that we can do for our patients.